Now we'll talk about two conditions that are kind of like related, okay? Which one is like a cause of one, right? So villous atrophy. Now let's just have a summary of this, and I think the lecture will be smoother. In your small intestine, where a lot of things have been absorbed back into the body, you have these finger-like projections. So it's the finger-like projections that help to like absorb things. So when these finger-like projections they start cutting off, they start wearing off, so to say. You see the atrophying. So this can actually lead to diarrhea in the sense that the stomach is not absorbing everything. So you have a lot of stool being passed out. You understand? So villous atrophy is just a condition where the finger-like projections as a villi in the small intestines, they flatten and destroy. Okay, so this can lead to malabsorption, and a lot of things are now being passed out in stool. So that's what will now lead to the diarrhea that we're talking about. So the villus could atrophy because of infections. It could be autoimmune disease conditions where your body is attacking its own cells. Okay, so we just spoke about it. Okay, so if the villi they kind of like wear off, nutrient absorption is impaired. So now a lot of things have to be passed out in stool, you know. So why it causes diarrhea is malabsorption. So undigested nutrients draw more water into the intestines. So because things are not being absorbed, there's much more water in the stomach. Fat malabsorption will lead to the presence of fat in stool, inflammation. So it can also trigger, and all of that. So causes, like what could cause the villi to kind of like atrophy? So celiac disease, tropical sprue, autoimmune enteropathy, giardiasis, common variable immunodeficiency, chronic diarrhea with villous atrophy. So all of these are culprits. So diagnosis is you do endoscopy with biopsy, serological test, to see if there's antibodies, stool studies, genetic and immunological test. So treatment is you basically, if you have celiac disease, eat foods that are free from gluten. If there are infections, you treat them. It is bacteria, antibiotics, these parasites, antiparasitics. Okay. The autoimmune conditions, you basically give drugs that will help to calm down your immune system. Then that's just all we have. Then supportive care, of course, the nutrients that are not being absorbed very well, you can now give them, supplement them to the patient.